Colm Keaveney.
The following is a newspaper report from the Irish Times dated the 11th of January 1940. It contains a criticism of the care of children born to unmarried parents by a Dr. W.B.F. Collis. And I will quote some of it, and I'd ask for your forgiveness with respect to the use of some, archaic terms. It goes on to outline in his observation that with respect to illegitimate babies, over 300 per 1,000 died before they reached the age of 1 in the care of these homes, and many more thereafter. Asked why so many illegitimate children died, Dr. Collis said it was the attitude towards them. When they died, he said, and it is quoted, that he believed that these things were arisen from neglect. And I repeat that there is no such thing as an illegitimate child, but there are illegitimate parents. That is the end of the quote. In the mortality rates, the forced adoption, the forced labour, the mechanics of shame, it is striking that all of these were largely done in the open. And society shaming women and children into homes, society's shame in what these women and their children ensured, that the dark events from our past, the unsayable, the unthinkable, but not the unknown, because it was known. And these homes have to be seen in the broader context of our fondness as a country for confining large numbers of our population into various institutions, including the mother and child, the industrial schools, Magdalen laundries, and mental health facilities. And I'm told at some point in our own history we had more people locked up as a proportion of our population than the Soviet Union. So I think as a society we have to face up to our own past with respect to institutions. In regard to Tuam, we know that almost 800 children died in the mother and child home, enduring a mortality rate that was far higher than the prevailing national infant mortality rate at the time. We know that their deaths were recorded, but their circumstance of their burial not. And we know that some, if not all of the bodies, were buried in unmarked graves in or near the site of the home. We know that there are some skeletal remains within a tank, most likely, it is reported, a septic tank or a crypt, which lies in a local authority estate on the Dublin Road in Tuam. It is a high mortality rate, and it's burial practice that raises alarm for the community which I represent. Tuam, however, I believe is not unusual in comparison to other homes, Minister, as you had alluded to in your previous statement. There are many things that we all need to know about such homes in general, including that of the Bethany home mentioned in the motion tonight. And we know that society, state, church combined to shame these women and their children. They sought to separate them from the so-called respectable society, to punish them for actions that were not crimes under statute law, that were essentially, punished and they violated the most harshful and unforgiving social codes that existed at the time. That resulted in this form of treatment for the most vulnerable people. And we know that the state and the church combined together and engaged in forced adoptions, aspects of which continue to echo onto our laws by our refusal to permit those people who are peppered across the earth to access their information that rests in files. And this long history of forced adoption in a country needs to be faced up to, and we need to look at amending the laws where necessary. Worse still, it's those that had been adopted were often, or not adopted, were often sent as virtual slaves into communities on farms or worked in businesses owned by so-called respectable persons in society. And I have personally met some of those former residents over the course of the last number of days, now entering into their old age, as you have said, Minister, who have, a living history that needs to be recounted and recorded. I've also met others who were not adopted or farmed out, or who were sent to the infamous industrial schools, who endured physical, mental, sexual torture by the hands of the organisation that were responsible for the running of Letterfrack. We also know of the vaccine trials or the clinical trials where they were carried out in children in these homes, and we want to know what did the state know at the time. The information is not new. We have known well over a decade about these vaccine trials, the extent of the practice, the questions of the state's complicit, who signed off on this from the Department of Health, what medical officers who were in charge of the Tuam or other mother and baby homes Will the inquiry establish fact around this? Will it assign blame, responsibility on institutions, groups, individuals? And I look forward to cooperating with the Minister in that respect. But returning to June, the current point of focus for the story, there needs to be a state initiative and to establish fact, a matter in this regard with respect to what is emerging around the absence of a formal burial location for near 800 missing bodies. And the matter is causing considerable distress to many families who suspect that their relatives are buried there, and it's also causing significant distress for people living in that area. Now, I've been contacted by some, and their distress is intensified by accumulation, speculation, and rumour. And once again, Minister, I call on you to move quickly to establish a proper investigation of the site. It should be noted that even if there's only one body discovered, it still leaves us with almost 800 children still unaccounted for. And even if we find all of 796 bodies buried in a neat row with obvious care, it will still leave us with a mortality rate which is in excess of the national mortality rate that prevailed at the time. So the site in Tuam should be properly secured, as should all the records connected with the site, and to ensure that all homes throughout the country are cooperating with their files, and obviously that the grave concern around this is the historical aspect of catching a picture with respect to the data and the files and the ledgers that existed. The mention of malnourishment, being listed as a cause of death is worrying, requires investigation, as does the exact function or management of the dying rooms. What are they? Who was monitoring this from the state, and who was monitoring it from the church? Have we spoken to the church about their willingness to cooperate with what records, and who are in both the state and in the church? Who was there at the time for oversight? Were any of the concerns noted at the time? What actions were taken? Who was negligent? And most importantly, I believe that the finances of the home need to be investigated. Where did the money paid over by the civil authorities, those operating the homes, go to?
Thank you.
Whose benefit did these resources go to? Are there any accounts available to you, Minister, with respect to the conduct of an investigation in establishing fact? Thank you.